This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. We're at Aurora Health Center in Oshkosh, and we're going to be talking with Dr. Loren Potter. Now, he's a surgeon in the orthopedic department, and today's topic is carpal tunnel syndrome. Well, thank you for joining us today. Let's talk a little bit about what exactly is carpal tunnel syndrome.
Well, carpal tunnel syndrome is it's a disorder of the median nerve as it's entrapped at the wrist. There's a ligament that lies over the top of the wrist, and the median nerve comes down from your neck down through your hand, and it is compressed inside of a canal which has a ligament lying over the top, 9 tendons running through it, and just one nerve. The base of the carpal tunnel is formed by 8 little bones in your wrist, and the compression happens there to the median nerve itself, and that's what carpal tunnel syndrome is.
Okay. A lot of people associate it, I've heard people that spend a lot of time on a keyboard, they tend to have that issue. But what are some of the other symptoms a person would have to maybe start to think, well, maybe I have this?
A lot of it is numbness in the fingers of your thumb, your index, your middle finger, and sometimes your ring finger itself. Sometimes it does come with typing, although they haven't shown that to be an overlying disorder with it. Most of it comes in the 4th to 5th decade of life, and it is associated with heavy jackhammering, but other than that, they haven't found anything to really tell us what exactly causes this.
Okay. And if you're having a problem, at what point should a patient seek your assistance?
At the point that it starts affecting your daily activities, if your fingers are starting to go numb, or if you start to have pain that even comes up your arm. I've even seen people that have pain that's in their shoulder that's associated from the nerve, as that nerve runs down from your neck, down through your shoulder, elbow, and into your wrist. If at any point that it's pinched along the way, much like if the electrical grid has a little bit of a stop in it, all the way back will be affected. So people have pain in their elbow, wrist, arm, and even into their hands. So if it starts affecting your daily activities, it's something that should be evaluated sooner rather than later.
And if it is evaluated that it is carpal tunnel syndrome, what are some of the options that are available to a person?
So we always start with the non-operative treatments. If a lot of times what it affects is at night, is everyone who sleeps at night, you sleep like you're back in the womb. So everyone sleeps with their arms curled up and their hands curled up like this. Well, that nerve runs down your wrist, and if you go like this and you flex it down all the way, you actually kink off the nerve itself. So that's what you wake up and you have to shake your hand out at the bedside. You end up with numbness and pain, and it wakes you up. And anyone who wakes up at night hates it. So the things that can be done for that is a lot of times we have a night splint that you can wear, and it's a Velcro night splint that just goes on your arm. And that sometimes takes care of the symptoms permanently, or it can at least delay a surgical procedure or some other kind of procedure. The other thing that is commonly associated with carpal tunnel syndrome is it comes with pregnancy. So it often comes with pregnancy. About 20% of people get it with pregnancy. So they will have numbness and pain, and it goes on for a little while afterwards, usually about 2 months. Those almost universally resolve on their own. All they need is a night splint. Other than that, I always send people to go ahead and have an EMG test, which is a nerve conduction test, that they test the nerve, because I want to see if it's pinched at the wrist. Is there a possibility that it's pinched at the elbow or the shoulder? Because if we have to do a surgical intervention and all we do is release it at the wrist, you're still going to have some pain and numbness in your hand from where it's pinched farther back. So just to make sure that there's nothing else going on further back, and that EMG will tell you that. And that's done by a neurologist or a physiologist. Okay.
If surgery is needed for a patient, what makes your surgery different from some other orthopedic surgeons?
So this is where there's a big difference. Is I did a hand fellowship and learned some different techniques with endoscopic carpal tunnel release. The traditional open procedure takes about 6 weeks to get better from. And what that is usually an incision on the palm that follows one of the wrist creases and is about this long. So the problem with that is that the skin in your palm is meant to grab onto objects and hold objects, so it's a thicker, tougher skin that's very difficult to get to heal, and the blood supply is not as good. The incision that I use is actually back into the wrist a little bit further in the soft, nice skin that has a good blood supply. So this incision is not used. The incision is used on the wrist is about 1 centimeter to 1.5 centimeters long in the wrist crease. And then I use this device, which is hooked up to a camera, up to a video source. And with help and looking through that, this actually slides up into the wrist. And then through the camera, I can see the underneath of the transverse carpal ligament. The knife is then deployed, and as it's brought back, that actually cuts the ligament underneath the skin, leaving all the skin intact. So the surgery is done all underneath the skin in comparison to this. This is about 6 weeks until you're back to work. And most people that I have who, if you do a sit-down or office job, can go back to work. If I do it on a Thursday or Friday, they're back to work on Monday. Oh, wow. A little bit of pain in their palm. Usually you need 1 pain pill that night to take, but otherwise are back to work in about 3 or 4 days, which is really big with today's economy. If you are a laborer or use your hands a lot for work, I allow you to go back in about 2 weeks with unlimited lifting. And then with the incision being back here, you can actually take everything off and you can shower over the incision and have it open to air at 3 days and just have a Band-Aid over it.
Wow, that's a great option.
Yes.
What other conditions do you treat?
I did a hand and upper extremity fellowship and then did 5 years of an orthopedic fellowship. So I do a majority of my surgeries, and the people I see are for shoulder, elbow, and wrist surgeries, but I also do knee and hip replacements and knee arthroscopy, along with general fracture work on the whole body as a whole, and all musculoskeletal complaints.
If anyone would like to come and see you, can they make an appointment directly with you, or do they have to get a reference from their primary physician?
Most people's insurance these days is you can just call up and have an appointment made on your own. You don't have to use your primary physician. I do like to know who that is so we can make sure that they're in the loop and that they know everything that's going on with you, as that's their job. So.
All right. Well, we appreciate you taking some time today, and that's a great option for surgery.
Thank you.
If you'd like to know more about carpal tunnel syndrome or to schedule an appointment with Dr. Potter, you can call Aurora Health Center in Oshkosh at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.